Hi, I'm Kylie Ward, Chief Executive Officer of the Australian College of Nursing. We are the national peak body for the nursing profession in Australia. We have almost 75 years of history and collective wealth and wisdom that we impart and want to impart, and have built up the profession as it is known today. Very proud to do that. We are a dynamic organisation and multi-pronged. We're a college in our own right, and then we have many other parts to the business. And particularly around the pre-budget submission is very much in that policy and advocacy space, not only in clinical standards of practice and professional practice, but in social impact and the contribution that the nursing profession can and does make, and in the way that we guide the expenditure of the taxpayers' dollars in good health outcomes through a values-based approach. And I think that is basically how we've flavoured our pre-budget submission this year, is considering areas of need, being mindful of the stresses that have taken place and will take place, and having a local and a domestic focus, but also always thinking a little bit broader, as we should in the nursing profession, of the greater good and how we can make the biggest impact. And so the budget submission and the priorities that we've put in are all about living our mission of shaping health, advancing nursing. FACN have really thought very strategically about what the nation needs and how we can best position the nation to receive the nursing care that they deserve over the next coming years with our budget submission. So we've invested in wanting more positions for the aged care transition to practice programs. We're looking at investing in nurses to undertake graduate certificates specific to the aged care industry. There's going to need to be thousands of nurses. In fact, they're saying about 25,000 nurses in the next 2 years in aged care. And really, we're only asking for funding for 5,000 nurses to do that postgraduate study to get gerontological specialisation. We are also we're looking at skilled migration. It's very important to have a multi-pronged approach to how we support and manage the workforce and the pipeline of the workforce now and into the future. We really see that there's been a lot of scholarships given and need to be given for clinical nurses and the work that they do, but one area that we see constantly left behind is investing in nursing leadership for nurse unit managers, nurse executives, nurse directors, clinical nurse consultants, nurse educators and nurse practitioners. And these are highly experienced nurses that take on a tremendous amount of responsibility, but often find it harder to get the support to do that training in leadership. And we would love for the government to invest in this space, particularly as nursing has really demonstrated over the last few years the investment that they've made in leading the health services and leading the care delivery of the nation for the areas that we're responsible for. And finally, we're actually asking in the pre-budget submission to go offshore. We're looking at our neighbours in the Pacific nations. We work very closely. We understand our responsibility in the region as part of the WHO region for Asia Pacific. And over the last few years, we have already been doing work in the space of educating nurses in the Pacific nations, and we've had a little bit of funding for that. And then ACN have kicked in quite a bit of funding ourselves, and we'd like the government to really look to investing in the future for our neighbours and giving them the education that will support them to meet their community needs. The Australian College of Nursing, over the last few years particularly, has strongly advocated and championed for changes to the aged care sector, and we've given evidence. We've been called as a witness to the Royal Commission. We've put forward strategies and solutions. So it's good to see that the changes are being implemented. But the changes that are coming in from the 1st of July are a starting point, and RN on every shift is where we start. Now, whilst we're grateful to get that, it's not going to be the workforce that the residential aged care sector needs going forward. But having said that, there's going to be thousands and thousands of nurses needed as we've transitioned from the social model of care that's been in for a few decades, that's really robbed the clinical side of it, to get back into putting appropriate levels of care in. The sector has also been so heavily hit in so many different ways around reputation, about leaving nurses isolated, about not enough nursing. So we also need to spend the time to actually invest in getting nurses reskilled, because often they will be working on their own, whereas in tertiary and hospital settings, you've got a lot of colleagues around. And the aged care sector has not been the most attractive sector because of the challenges that have been imposed upon it. And so we need to do a little bit of recovery, we need to do investment, and that's why two of our strategies particularly are around aged care, and then even another strategy around the investment in the management for leadership training could also support the aged care sector. If we can keep people in aged care that need to be in aged care, or keep people at home that should and could be at home, then we take the burden off the acute system. So it's a really good investment in money. If we don't do it, what are the consequences? We have frail, vulnerable, isolated and lonely older Australians that will deteriorate, that will suffer. And realistically, it's who are we as a nation if we don't invest in our older Australians in the way that they've served and sacrificed? The least that we can do is provide the care that they need so that they can age as they wish to and stay as healthy as long as they can and have quality in these years. I cannot reinforce enough the importance of investing in scholarships for nursing leadership. There are a lot of scholarships that do get given for clinical qualifications, and that is absolutely important. And we've said that for the aged care sector, particularly because they earn less. But once you get to be a manager in nursing, nurse unit manager or an ANUM, and go into the mid-career component of your career and then up to director of nursing and beyond, you are managing millions and millions of dollars, dozens of people, if not hundreds, if not thousands of people. Some of the nurse execs in the country have 7,000, 8,000, 9,000 nurses and midwives in their workforce. Any other industry, you would never promote or expect people to work in here without supporting them with really good, solid management training and education training. And the reason that we're advocating so strongly is because it is such a complex area, management in health, and nursing is such a stronghold of that. But from the budgets, the skill mix, the logistics, the flow, the supply chain, the stock, and then looking at the HR side of attracting and retaining a workforce. Some of that workforce you don't often see because it's 24/7, requires great leadership skills. There's brilliant examples of nurses who have that, but not everybody has those qualities naturally, and it is really important for the government to understand that we need to invest in that. I would couple that to say that particularly over the last few years, nurses and nurse managers have been leading under disaster-like conditions, and that has to be taken into consideration with the pressure on themselves. So expert clinicians need a different set of skills when they then transition into a career in management, and we would like to see the government fund that to give them the support to be just as good in their management career as they are in their clinical career. There's so many areas of need and priority. But having said that, what kind of leadership would we show as the nursing profession if we didn't consider what was happening very close with our neighbours in the Pacific nations? And we've had very close relationships at the Australian College of Nursing with our nursing colleagues in the associations in the Pacific nations, as well as the chief nurses. And often, and probably critically, we are a destination for Pacific nation nurses as well. And so I think it's really important that we give back and that we give the nurses in those nations the opportunity for self-education, self-fulfillment and self-empowerment, rather than thinking, when there's a little bit of a challenge, a crew can fly in and you can have a deployment and you can support the nurses. So in 2020, when when we knew that we were going into a pandemic, I did what I needed to do in my role for Australia, but then very quickly, because I've got contacts in Fiji, I rang them and I said, "You okay?" And I rang my contacts in Asia. Asia was a little bit ahead of the game in all the Asian countries, but the Pacific nations, some of the leaders over there that I spoke to said that they didn't really have the workforce that would be able to look after ventilators. And that absolutely was a concern to me and to them. And so we went about and worked with DFAT and got funding for 2 nurses from many of the countries to undertake a graduate certificate in critical care, so that if and when the time came, they would have the qualifications to be able to manage ventilators and support people locally. What we realised, that funding fell a little bit short, but there was 15 nations, 16 nations actually, that wanted nurses to do the course. So the Australian College of Nursing funded that because we didn't want our nursing colleagues to miss out. And to their credit, with our online training, they've met Australian qualifications. But there are challenges, and the logistics of the support that is needed is far greater than is experienced here. We're very skilled now with this. I went over last year to talk to the nurses that have graduated, the difference that makes in their teams and in their communities and in their facilities is tremendous. And since then, we've also been providing courses in peri-op nursing. So we would like to extend that. That's something that we can do. We're prepared to do. I've got brilliant nurse educators who want to continue to work in that area. We're close. It's important that no Pacific nation should miss out. And so that's why we actually invested in nurses in every one of the Pacific nations that put their hand up and would continue to. And I know this government is committed to building those relationships. So there's the graduate certificate level. We want people to be educated at the level that we would expect of in the Australian system and for the care that we want to give to our communities. So we've offered and delivering that and need more funding now. That funding's run out. But the other side of that is that there's different levels of courses that we can offer. And so the principles of emergency care is really important. And to be able to offer 1,000 nurses throughout the Pacific nations to do that course, which is a 12-week course, different from a year, different kind of study, different accreditation and attainment of qualifications at the end, but certainly gives a level of skill that we would be proud to have in Australia. It's a great question, and I'm going to start by saying I have been criticised and heavily criticised over the last few years, even by some of my nursing peers in other organisations, because I champion for skilled migration. Sometimes what you've got to champion for and what you know is right isn't always popular. And why do I believe in skilled migration? There's a couple of reasons. First and foremost, nursing has been in Australia in its current form of evolving as a profession for over 150 years. But for many decades, nursing was the only profession for women, and nursing was known as a profession that could take you around the world. So skilled migration is not new to us, and Australian born or Australian citizens and nurses will go overseas. So it is something that we've always had, this flow and this currency that people go and have an adventure overseas and stay for a while and come back. And we already have a workforce that is rich in diversity and inclusion. I do worry about the undertones of racism that I hear in some of the comments. I'm particularly concerned when I hear it'll take away jobs from Australian graduates. Skilled migration isn't new graduate migration. We're not taking new graduates from overseas and filling them into positions here. They're skilled workers that are looking to move abroad. Now, some of those will be from first world countries and some of those will be from third world countries. And there is the ethical component to consider. And one of the considerations that I've given a lot of thought to is, we accept and welcome nurses from countries that are considered less privileged than ours, or maybe a third world country. And when you talk to nurses that come from those countries, that make Australia home, that nursing is a ticket to an opportunity, to another way of life, to investing in their families. And so who are we to take that right away? If we're taking from populations because we're more privileged just to fill our gaps on broken systems and unhealthy cultures and disrespecting the people that we bring in, that to me is unethical. We also have countries that are coming over from first world countries at the moment. We've recently had the UK and Ireland over here, and that's happened for many, many years. And we go over to those countries to attract and recruit nurses from the UK and other places. I think from the perspective of the Australian College of Nursing, we've always believed in the value of skilled migration done properly and done ethically. And we invest in programs to support nurses who come from overseas. For many years now, we've been a leader in delivering the bridging and re-entry to help people meet their registration requirements and go through some intensive study to meet our standards. We do need to think about cultural awareness, cultural safety and cultural appropriateness, obviously for First Nations people, but every person has a culture they connect to. And there needs to be the thoughtfulness around who gets those visas for migration, how we support them in the communities that they're integrated into, and the opportunity to bring their family or the networks so that they can make Australia home. They can be welcome here for as long as they wish to be, as I would hope for the nurses that head overseas to other countries. So just to give you an idea, at the beginning, pre-COVID, we had a waiting list of people wanting to do our course to come over. It was thousands. And by the time we got to about 2021, I spoke to the minister at the time, that had reduced by 90%. So Australia was, I could already see through the pandemic, Australia was less and less attractive, and some of the strategies that we were putting in place for our own protection was not resonating in how we valued people from overseas. So we had teams of people communicating, and those people that were hoping to come here and were on waiting lists and let us know ended up going to other countries. The World Health Organization and the International Council of Nursing, before the pandemic, estimated that by 2030 there would be a 6 to 7 million nursing workforce shortage worldwide. And then last year, the CEO of the International Council of Nursing, Howard Catton, came out and said it's now 13 to 15 million. And that is something that we need to understand what we're doing, how we're doing our workforce planning, and how we're presenting as a nation to the rest of the world in terms of the reputation that we have, being a destination of choice, an employer of choice, and somewhere that people would want to come and work and live, whether that be forever or for a period of time. So we have a global workforce shortage that is only going to be impacted upon. We, for the last 2 years, have seen decreased numbers of nursing intakes throughout the university sector for registered nurses. So the pipeline means that in a couple of years, we're not going to be graduating the same numbers of new graduating registered nurses that we have in previous years. So if we don't think about the pipeline and the multi-pronged approach about who we'll bring into the workforce, we're absolutely going to be in devastating and stressful conditions around who is left walking and holding the fort, and how we're taking care of them, and how we attract and retain. And I don't want us to get too desperate to be in that place. So what we've said to the government in the pre-budget submission is skilled migration must be a strategy of any government for the nursing workforce. It always has been, it's always going to be. If Australia stops this, the world will keep. Nurses will keep moving as an international passport. And in fact, I would like to see that regulation is broader than nations, and I suspect that will come in the next few years. So I would like to think that we will be proactive, we will be ahead of the game, we will be ethical, and we will be respectful in how we attract people, how we receive people, how we welcome people, and how we say goodbye to people, who go off for an adventure as well. I think coupled with that, we need to understand the demographics of the Australian population. It was only a couple of years ago that 1 in 4 Australians was born overseas, and now it's over 40%. So almost 1 in 2 Australians are born overseas. And for us, it's really important that we have a workforce that is just as diverse and represents the people that we serve, and to consider all of the empathy, the cultural awareness, the richness of what people bring, and who they are, and how they complement teams, so that we can deliver the care as a profession that we should be delivering, and for the Australian College of Nursing that we want to deliver. And that diversity comes in many different ways, but this really is around race and nationality. And so for me, I will continue to champion it, as uncomfortable as it might be for some people to hear. And nurses will continue to travel, and there will be other nurses who want to come to Australia. Will we be mature enough to receive them in the way that we should, is I guess the question for this government and a future government.